Enjoy life and stay healthy. I'm Pylori Master Mandoline. After today's video, you'll likely decide to get a gastroscopy or become concerned about Helicobacter pylori infection. As the title suggests, stomach cancer and Helicobacter pylori are closely related. Most cases of stomach cancer are actually linked to Helicobacter pylori. Here is the risk of stomach cancer caused by Helicobacter pylori. It's said the risk increases over 15-fold. How should we test for Helicobacter pylori and eliminate it? Who is more at risk? I'll explain these points simply. Gastroscopy can be tough. Some try it once and never want to repeat it, while others are put off just hearing about difficult experiences. I think there are a lot of people who just don't want to go through it again. I had a gastroscopy once myself, and I was drooling the whole time. I couldn't stop gagging, and after the procedure, I thought I'd never go through something like that again. But actually, nowadays, you can have a gastroscopy done using sedatives that help you sleep during the procedure. There's also a method called transnasal endoscopy, where the camera is inserted through your nose to make the procedure as comfortable as possible, so please check with your hospital about it. I've heard some people say it made things much easier for them, and now they're able to get a gastroscopy every year. So first of all, you might be wondering, what exactly is Helicobacter pylori? Let me start by telling you just how remarkable Helicobacter pylori is. The stomach's interior is a very harsh environment. The inside of the stomach is actually more acidic than a lemon, and it's filled with hydrochloric acid. In fact, hydrochloric acid is said to be so strong that if it got on your face, it could melt your skin. That's the kind of substance that's inside your stomach. The only one that managed to survive in that environment is Mr. Pylori. Yes, Mr. Pylori. Because only Mr. Pylori could live inside the stomach, he was able to rule over it. So, since Helicobacter pylori has no enemies, it can keep multiplying more and more. In order to fight back against it, our bodies cause inflammation to try to get rid of the bacteria, which leads to gastritis. Gastritis increases the risk of stomach cancer and gastric ulcers. This Helicobacter pylori is quite a formidable enemy. Now let me explain how this bacteria infects people. In the past, the infection route was mainly through natural sources like well water or contaminated water. However, as living conditions and sanitation have improved, recently it is said that most cases are due to mother-to-child transmission. For example, when a parent chews food and then feeds it to their child, that can be a cause of infection. And here it says, kissing. But do you all know whether you can get infected through kissing? Actually, it's generally said that Helicobacter pylori is not transmitted by kissing, so please don't misunderstand that. Now, about the prevalence of Helicobacter pylori. Roughly speaking, for people over 50, it's said that about 60 to 80% are infected with Helicobacter pylori. Being infected means your risk of stomach cancer is about 15 times higher. For people in their 20s, it's said that about 20% or 1 in 5 are infected, so it's still important to get a gastroscopy. I think it's a good idea to check whether you have Helicobacter pylori or not. Well, I've been talking on and on like this, but usually I'm a general practitioner in Hokkaido doing gastroscopies and also performing Helicobacter pylori eradication. On YouTube, I discuss topics I can't cover in consultations due to time limits. I share tips on getting healthier in a fun way. Did I just stumble over my words? If you want to support me, please like and subscribe. So what should you do if an endoscopy reveals you have Helicobacter pylori? If it looks like you might have H. pylori, we perform tests at that point. There are many tests, including the urea breath test, where you blow into a bag, blood tests, urine tests, and stool tests, so there are plenty of options. You can leave that to us. There are many tests and it can get confusing, so we'll ensure you get the right ones. Once we find out that you have Helicobacter pylori, then we can finally start the eradication therapy. Please keep in mind that basically you won't be able to undergo eradication unless you have an endoscopy. As for how the eradication is done, it's written here. You'll need to take the medicine twice a day, in the morning and evening, for 1 week without forgetting. This part is important. To make sure you don't forget to take your medicine, avoid starting eradication therapy during a week when you have travel plans. Also, you must not smoke. If you smoke during the eradication period, there's a chance the therapy won't work. So, you should stop smoking. The success rate of this eradication therapy nowadays is said to be close to 90%. Since the success rate is 90%, there is actually a possibility that about 10% of people may not succeed. In such cases, we perform what's called secondary eradication, which means doing the eradication therapy one more time. However, the success rate for eradication at that time is said to be about 95%, so you can rest assured that almost everyone can be cured after 2 rounds of eradication. If it still doesn't work, then we move on to what's called third-line eradication therapy, but in that case, it has to be done at a specialized institution and will be at your own expense. So ideally, we want to complete the eradication within the first 2 attempts. Now, to check whether the eradication was successful, after finishing the medication, you need to wait at least 4 weeks. After waiting 4 weeks, visit the outpatient clinic to check if the eradication was successful. There is still still a possibility that it might not have worked, so even if you finish taking the medication, don't assume you're done or safe just because you finished the medication. My main point is that even after eradicating Helicobacter pylori, which raises stomach cancer risk, you still need regular endoscopies. People who've had the bacteria remain at higher risk than those who never had it, so yearly screening is still necessary. Ultimately, an endoscopy is still recommended. You might think eradicating Helicobacter pylori isn't necessary, but removing it cuts your stomach cancer risk by 2/3, so you should proceed with eradication. In the end, compared to people who have never had Helicobacter pylori, those who have been infected and then eradicated it still have a higher risk, so it's important to get a thorough endoscopy every year. And another important point is that for people whose stomachs are healing after Helicobacter pylori eradication, it can actually be harder to detect small, early-stage stomach cancers. That's why it's important to have regular follow-ups every year to check for any changes. It's also important to keep checking that the eradication was successful, and I think a lot of people are curious about this. There's something called the ABC screening. This is an optional test you can take during a health checkup, and to put it simply, it's a test that lets you check for Helicobacter pylori without having to undergo an endoscopy. So it's popular among people who are afraid of getting an endoscopy but still want to know if they have Helicobacter pylori, and recently, more and more people are choosing this test. However, ultimately, if you have Helicobacter pylori, you'll still need an endoscopy, so even with ABC screening for now, if the result is negative, you don't have to get an endoscopy. Honestly, as someone who performs endoscopies, I don't agree with just skipping it. The reason is, just because you don't have Helicobacter pylori doesn't mean you can't get stomach cancer. In terms of cancer screening, there are cases of stomach cancer without H. pylori, so whether you have the bacteria or not, you should still get an endoscopy. There's a point in getting screened, so rather than taking this ABC test, you should first get an endoscopy. I think it's meaningless unless you clearly determine whether you have Helicobacter pylori or not. So if the ABC test shows you have H. pylori, you'll end up getting an endoscopy before starting eradication therapy, so you can't avoid the endoscopy after all. Well, what did you think? Lastly, I believe there are many people watching this video who are worried about their health. Since there is so much information out there, it's hard to know what's true. That's why, as a doctor, I want to share accurate, data-based information. Through this channel, I want to make sure everyone gets a little healthier over time. If you'd like to support me, please hit the like button and subscribe to the channel.